I think that the industry, unfortunately, it's built on invasive treatments. The professionals, they see the prevention, they want to spread the self-care, good practices, but still
This is the TechDental Podcast, the strategic intelligence hub for leaders shaping the dental industry. We break down how AI, data, and operating discipline drive performance and scale. I'm Dr. Randeep. Let's dive in. This is the show where we go beyond surface level AI talk and focus on what actually moves the needle in dentistry: systems, scalability, cash flow, and long-term value creation. Today's episode is about something most practices say they care about, but very few have truly cracked at scale, and that's prevention. Not as a slogan, not as a hygiene conversation, but as a system, a workflow, and increasingly a data problem. I'm joined today by Mika Malinen, CEO of DentView. Mika brings a strong Nordic health tech background, a research-driven mindset, and a very pragmatic view of how AI should actually be deployed inside real clinics and large organizations. Mika, welcome to the TechDental Podcast.
Thank you, Randeep, for inviting me.
Before we get into the conversation, it's worth stepping back for a moment. Prevention has always been dentistry's stated priority. Every dental organization talks about it, every conference panel mentions it. And yet structurally, the industry still runs on treatment. Most dental workflows are built around appointments, procedures, and production targets. Prevention, by contrast, happens outside those structures. It happens at home, between visits, in the everyday behaviors that determine oral health. That creates a structural tension. Because if behavior determines outcomes, but the system is designed around procedures, then prevention will always struggle to scale. So in this conversation with Mika Malinen, I wanted to explore prevention through a different lens, not as a clinical message, but more as an operational system, a workflow, and increasingly a data problem. And I want to start very simply. If you had to describe DentView in one sentence for DSO executive or a CFO listening to this, how would you frame it?
It's AI-powered digital system with a strong prevention edge, but which ultimately improve the dental clinic business as well.
What I find interesting is that DentView exists in a space that most dental tech avoids. So let me go one level deeper. What was the specific failure in dentistry or in dental business that motivated you to build DentView in the first place? Where did you see a gap?
I would say that everything leads to a woman. So my wife is a dentist, and she was working in the public healthcare in Finland. She's still working there. And there was a problem that there was a patients coming from windows and doors, or you say it, and there was no time for self-care. So basically there was no time to do that. And when there was a possibility to give proper self-care, the difference could be significant in the person's life. The motivation and the general well-being was so significant. So we thought how we could scale this, how we could keep everybody prevention in a standardized, equal way.
Why do you think traditional prevention doesn't scale, and why education alone doesn't change behavior in patients?
I think the problem generally is the resources. There is a huge workload in the dental professionals. There is no time, and there is no financial resources to give proper self-care to everybody.
One of the strongest statements tied to your work is the future of oral health is behavioural, but dentists cannot do the behaviour for the patient. So just unpack that for us a little bit. Why does prevention fail when it's locked into the dentist chair time?
The behavioural changes are done at home. So that's the key issue. Let's take one example. If there is a dental fear patient in the dental chair, the patient cannot take any information in that situation. So ultimately, there is something the dental professional can do, but still, let's say there is 2 visits a year in the dental clinic. And that's quite optimistic view. So everything that happens between those visits is the most important.
Your research shows that digital self-care guidance can match in-person professional instruction in just 1 month. That's a quite bold claim. From your perspective, why is behavior change better delivered digitally? And what does AI enable here that humans simply can't do at scale?
That was the very promising research result that was done in the Turku University. Orthodontics specializing doctor was doing the study. So they had two control groups. The group that got the self-care introductions via digitally, and the one group that got it from the orthodontic specializing doctor. But there is a big difference. When the self-care is given by a professional, it's limited to one person's working time. But when it comes to the digital means, there is no limits. You can scale it to the entire population level. So even if we can get close to the professional level, that's a huge opportunity.
It's interesting because essentially what you're doing is you're increasing access to prevention at scale using AI and tech. And you're not relying on one dentist's time in the chair, which is limited, and then they try their best, but they're rushed off their feet. So there's only so much you can do in a limited appointment. Let's talk scale now, because this is where things get interesting for groups and DSOs. From an operator's perspective, where exactly is the labor arbitrage happening? What roles get relieved first? Is it the front desk, hygiene, or clinical time?
I would go first with the dental hygienist. And of course, dentist. I would go with these two professionals whose main job is to increase the awareness. If you talk about the private clinics, it affects the whole system. If you save 10 minutes per patient, automating interviews, having the gamified self-care education given, you can do it much better. On one side, the professional can see the self-care practices, risks highlighted, AI analysis also from the things that interest private clinics, let's say the upsell opportunities. If there is an opportunity for the private clinic to offer some services, some hidden demand. So let's say that the patient, you get to know their self-care habits, their tobacco use, which is really important. Maybe there is a need for medication, or you can see it right away. And then you can see that there is some unhappiness with their smile.
It's interesting because it's actually using prevention, which is a really important facet of clinical dentistry, but turning it into an operational lever for the business growth as well. So it's interesting how you paint the picture of the whole system being affected. Let's talk a little bit about the part that people underestimate. Just explain a little bit about how behavior data becomes a structured revenue signal, not just a soft insight.
When the patient enters to the clinic, there is a logical continuation of the workflow and what you do with the patient next. We have found out that these kind of gamified programs, you can map large amount of data in a quite short period of time. So for example, in our case, the program lasts 4 minutes. So within this time, you can basically educate, map the self-care practices, and also map if there is a hidden demand or unhappiness with the patient to some condition in their mouth. So the AI will analyze it, and then professional can open the session of the patient. They can review the self-care data, and AI will make analysis. And based on the all data that they have got from the patient, they will create a recommendation for the professional so that it's as easy as possible to approach the patient when it comes to that upselling opportunity in aesthetic treatments. That's quite complicated issue that it's really like without patients saying anything, it's really hard to start selling aesthetic treatment for a patient because somebody might get frustrated about it if you offer them a wider smile, if they're already happy with their smile.
It's quite interesting because what I hear you saying is that it actually allows the clinicians and treatment coordinators to open the conversation naturally with patients because it's being done by their own data and it's being done from the lens and image of prevention. So it takes out that roadblock of where patients feel that you're trying to sell them something because essentially they are seeing it themselves and it's something which is being analyzed by data.
You know, the big DSOs, they have nice systems, but the Ones that operate in a smaller budget and smaller revenue, they might have only patient record system. So we have wanted to build a system that is really easy. There is no long duration processes, and also that the cost of the system is really transparent. We have built a technology that you can white label it so that they can customize the content, they can customize multiple things so that it right away feels like part of their clinic.
Why is behavioral data the missing layer in both public oral health and executive level forecasting?
From the very beginning, we have collected huge anonymous data bank. Currently, we have 250,000 sessions from people's self-care behavioral data, which is anonymous. We have built a data bank so that our customers can basically collect their own data and then review it based on the location, based on the age groups, spoken language, and with the different variables. This kind of big data gives operational management tools to evaluate behavioral trends among the population. Different kind of self-care habits, or it might be a cultural thing, it might be a socioeconomic, but they can spot trends and act accordingly.
What Mika is describing here really touches on a much bigger structural shift that's happening across healthcare. For decades, most health systems have been designed around episodic care. A patient appears, receives treatment, and leaves. But prevention doesn't operate in episodes. It operates continuously. And that creates a mismatch between the way healthcare is structured and the way behavior actually changes. In dentistry, that mismatch becomes particularly visible. A clinician might see a patient twice a year, but the behaviors that determine oral health, be it brushing habits, diet, tobacco use, self-care routines, these all happen every single day. So the question becomes, how do you influence behavior at population scale when clinician time is limited? That's where digital systems and AI start to become interesting. Not because they replace clinicians, but because they extend the reach of the system beyond the dental chair. And when that happens, prevention stops being a conversation and it becomes infrastructure. I want to bring this home for the CFOs listening. From your perspective, how would this stabilize cash flow, and how would you explain this to the CFO of an organization?
With the one dental hygienist monthly fee, you can scale the prevention research-backed. The prevention itself, it engages the patient. If you have the home tools also in active use, it will tie the patient to the clinic. So there is a brand impact. The dental clinic really shows the patient that they care. They are not there just for the invasive treatment and making money. They actually care about the patient. Of course, the time saving, the self-care education, and automate the interviews. The one dental hygienist or dentist, they can take more patients in. So definitely it makes the clinic more efficient. And then the upselling features. For example, there was in 1 month, there was 6 to 10 teeth alignment leads in one clinic. And when you count the whitening, the ceramic, fillings, everything, the potential upselling is, it might be even €500,000 in a small clinic. Let's say the chief financial officer is not from dental field. They might not see the prevention advantage, but if we can bring them numbers, like concrete numbers, that what this prevention edge software can do in regards of revenue and how they can improve their business, make it more profitable, and with the same time build their brand.
One of the interesting dynamics in dentistry is that prevention has always been framed primarily as a clinical responsibility. But increasingly, it's becoming an operational and strategic question. For practice owners, group operators, and DSOs, prevention is no longer just about oral health outcomes. It intersects with workforce capacity, workflow design, patient engagement, and long-term revenue stability. If prevention can be delivered more consistently between visits, it doesn't just improve health outcomes, it changes the economics of the practice. And that's where many of the emerging AI platforms in dentistry are focusing their efforts. not on replacing clinicians, but on redesigning the system around them. I love the vision there. And we've come to our lightning round. At the end of the podcast, I always like to do three quick fire questions designed to give our listeners an insight into your mindset. So let's kick off. The first question is, what's one belief about preventive dentistry that AI will completely disrupt?
You can basically scale the prevention to entire customer base if you want to. So there is no limits at the moment.
What's one mindset dental leaders must adopt if they want prevention to scale?
I think that the industry, unfortunately, it's built on invasive treatments. The professionals, they see the prevention, they want to spread the self-care, good practices, but still the whole industry is built on invasive treatments. So that needs to be changed. I think the behavioral change is the key, that we have to switch our thinking from invasive treatments to the prevention and see it not as a threat, but the opportunity to engage patients, give standardized self-care, and spread it everywhere. And as we know that the dental disease, they affect the weaker socio-economical status people more. So I think it's time to switch the mindset.
One entrepreneur or innovator you'd love to have dinner with and why?
Politically, you might feel not good about him, but when looking about the business perspective, I have to say Elon Musk, that the guy is doing so much.
I've really enjoyed this conversation. Thank you for sharing your valuable insights with our listeners. Where can people connect with you and learn more about DentView?
You can go to our website, dentview.fi or dentview.ai, and then you can find me also from LinkedIn and send me a DM.
When we talk about prevention in dentistry, the discussion often becomes philosophical. Everyone agrees it's important, but very few systems actually have operationalized it at scale. And that's the key point. Prevention is not primarily a knowledge problem. Dentists, hygienists, the rest of the clinical team already understand prevention, and patients broadly understand it as well. The challenge really is structural. Most dental organizations are designed around treatment workflows, appointments, procedures, and production targets. Prevention, by contrast, sits outside those workflows. It lives in behavior, and behavior is inherently harder to influence than procedures. What's beginning to change now is the emergence of digital infrastructure capable of bridging that gap. Systems that capture behavioral data, platforms that engage patients between visits, workflows that extend the reach of clinicians beyond chair time. When those pieces start to come together, prevention moves from being an aspiration to being a measurable system. And that shift matters not just clinically, but economically. For operators and DSOs, scalable prevention changes workflow utilization. It changes patient engagement, and potentially it changes how dental organizations think about long-term value creation. Because ultimately, prevention is not just a clinical philosophy, it's a systems design challenge. And the organizations that solve that challenge first will likely shape the next phase of dentistry. You've been listening to the TechDental Podcast, Strategic Intelligence for Dental Leaders Navigating Structural Change. If you're responsible for growth, performance, or long-term value in this industry, make sure you're subscribed. I'm your host, Dr. Randeep. We'll see you next week.